Good afternoon, Miss Judith Simon.
Good afternoon.
My name is Berilyn Akwe, and I am a doctor of nursing practice student at the University of Massachusetts Amherst. This is my third year, and I am in the family nursing practice program. I will be completing your assessment this afternoon, if that's all right with you.
Okay. No problem.
Alrighty. Thank you very much. So let me grab a seat so we can. Can you remind me your date of birth, please?
February 7, 1975.
Okay. And that will make you how old now?
43.
Alrighty. Thank you. And where are you originally from?
Haiti.
From Haiti. How long have you been here?
7 years.
7 years. How do you like it here compared to Haiti?
Okay.
Just okay. Home is home, I guess.
Oh, yes.
Uh-huh. Do you have family here?
Yes.
Okay. So at least it's not as bad if you have some family here.
Especially my mom. If she was here, it would be perfect.
Oh, your
I
mom.
miss her a lot.
Oh, I'm sorry to hear that. So your mom is back home. So who do you have here as family?
My father.
Okay. And do you live with your father?
No.
Do you live alone?
No, I'm married.
Okay.
I'm with my husband and my daughter.
With your husband and your daughter. And how old is your daughter?
17.
Oh, you have a 17-year-old daughter. You don't look like you have a 17-year-old daughter. I guess people think she's your sister, huh?
All the time.
Mm-hmm. Alrighty, so what brings you in today?
Annual checkup.
Just annual checkup, that's good. So when did you have your last annual checkup?
It was in May last year.
May of last year, and that will make it just about a year. Or a year and a month. This is almost the end of the month. Okay, that is good. So what prompted you to schedule for today?
Just a routine.
Oh, just a routine checkup.
Yeah.
All right. So when you went last year, what were the results?
Everything was good,
Okay.
and I keep doing the same thing.
So what do you do to keep you healthy?
Eating healthy, exercising,
Okay. And what kind of exercises do you do?
and do Zumba
Oh, you do Zumba. I love Zumba. Okay. How often do you go to Zumba?
twice a week,
And for how long?
2 hours
Oh, 2 hours.
per day.
So that makes it 4 hours
4
of
hours.
Zumba every week. Wow, that is really good. And how is your diet?
Good. A lot of vegetables, fruits,
Okay. And
and I don't eat after 5. After 6. I don't eat every meal after 6.
oh, that's good. And what kind of drinks?
A lot of water.
Oh, how much water on average do you drink?
4 bottles.
4 bottles.
Oh.
And the small bottles or
The medium one.
the medium ones, that is, I think the 16 or 17 ounce bottle.
I
16.
think it's 16.
No, right. That is actually really good. Except when it's hot and you're sweating more, you should probably drink a little bit more. But 4 bottles, that'll make it 2 liters. That is actually really good. So, any stressors?
Nope.
No. Okay, that's good to know. So, do you have any food allergies?
As I know, no.
No. All right. Just look back to even childhood. Have you had any hospitalizations?
Nope.
Okay. So, did you have your daughter in the hospital?
My daughter?
Mm-hmm.
For routine.
Oh, okay.
Oh, my daughter, if I had it Give birth to her in a hospital?
Mm-hmm.
Oh, yes.
All right. How long were you in the hospital for?
For 2 days.
Okay. Was it a normal delivery
Yes,
or
it was.
did you use any anesthesia?
No.
Oh, you went natural.
Yes.
Wow. You're a strong woman.
Mm.
So, and were there any complications?
No.
Okay, that's good. And have you had any major illnesses?
No.
Do you know if you ever had measles?
Yes.
What of chickenpox?
No.
Have you ever had mumps that makes your jaw swell?
Yes.
Okay. And what, tuberculosis?
No.
No. Asthma?
No.
And even in your family, say your mother, your father, siblings, anybody with any major chronic illnesses like hypertension, high cholesterol, asthma, heart disease, cancer.
I know my father, he has glaucoma.
Mm-hmm.
That's it.
Okay. All right. Have you ever been involved in an accident?
No.
All right. And any head trauma?
No.
Okay. And do you take any medications routinely?
No.
Any over-the-counter medications?
Sometimes Tylenol.
Okay. And how often do you take the Tylenol?
I can't even remember because I don't remember when the last time I took one.
And what do you usually take it for?
Headache.
Headaches. How often do you get headaches?
When I'm gonna have my period.
Oh, okay. I see. And when was your last menstrual period?
It was last month. I don't know.
Beginning, mid, or ending of last month?
It was mid
Okay.
May.
So it was mid-May. Fantastic. So you said your father has glaucoma. What of your mother? Do you know if she has any chronic condition?
I think she has high blood pressure, but they gave her medication, and I think now it's stable.
Okay. So are they both here? I know you said your mother is
In Haiti.
in Haiti. Okay. So where's your father?
Here he's living in Cambridge.
Okay, he's in Cambridge. And do you have any siblings?
From my father's side.
Okay. And how is your relationship with your parents and your siblings?
Not close. With my siblings, not too close.
Oh. And
But my parents, yeah, we have a good relationship.
so are you older or younger than your
I'm
siblings?
older.
Did you grow up together?
No.
Oh, I see. Okay. So, how is life at home?
You know, I'm not gonna say excited and boring, but it's in between.
Any particular concerns? Anything that you think you could do to make it better?
Having more money.
We all need more money at some point. So, what do you do for work?
I'm a CNA.
Oh, you're a CNA. That's good. And do you work in a hospital or
In a group home.
in a group home? Oh, okay. That is good. So, full-time or part-time?
Full time.
Full-time. And does your husband work?
Yes.
All right. Yeah, your daughter is still a little too young for work.
But she has a part-time job when there's no school.
Oh, okay.
Mhm.
And 17, she should be in high school.
Yes.
Alrighty. So, okay. Apart from money being the stressor, any other thing that might be bothering you? Do you sleep all right?
Yes, I do.
On average, how many hours of sleep do you get?
7.
7 hours every night?
Mm-hmm.
And is it like straight 7 hours of sleep, or your sleep gets interrupted and then you go back to sleep?
Straight.
Or 7 straight hours of sleep? Okay, that is good. And are you sexually active?
Mm-hmm. Yes.
Okay. So I'm going to ask you some questions. They are mostly going to be yes or no questions, just for a review of system from head to toe, just to make sure we have everything covered before we move on to your physical examination. So please let me know if there is anything more that you want to tell me. So, how do you, on considering the people that you know, most people you know, do you think generally health wise you're better than most of the people you know at the same level, or worse than most people you know?
I'm the same level.
Same level. Okay. Have you had any weight changes lately?
No.
And fatigue,
No.
tiredness,
Sometimes.
sometimes, and what times?
When I need to wake up in the morning, I want to stay in bed.
You want to stay in bed when it's time to wake up.
Oh yes.
Do you have any chills,
No.
night sweats?
No.
Okay. And your skin and your hair, do you have any concerns? Any rashes, pain, tenderness, any moles?
No.
Okay. Any itching?
No.
And what of your eyes? Do you see okay?
Yes.
Okay. Any pain or itching? Any visual changes?
No.
When you change position, do you feel like you want to black out?
No.
Okay. And do you feel any lumps anywhere on, say, your body?
No.
Okay. Any headaches? Okay. Dizziness?
No.
No. Any drowsiness?
No.
Nausea?
No.
Vomiting?
Mm.
Okay. And do you hear me all right?
Yes.
Any ringing in your ears?
No.
Any discharge?
No.
Do you often feel like you're off balance?
No.
Okay. And do you feel like you're stuffy?
No.
Any pain or pressure around these areas over your sinuses?
Mm-mm.
No. And any nosebleeds?
No.
Okay. Do you feel any blockage in your nose?
No.
And in your mouth, do you feel any mouth and throat, any soreness?
No.
Okay. Any pain? You feel? Do you feel like there's some swelling in the back of your throat or anywhere in your mouth? No soreness in your mouth as well. Okay. And you breathe okay?
Yes.
You ever get short of breath?
No.
And can you do, say, 20 steps? 20 stairs, like climb 20 stairs without running out of breath? Do you run out of breath when you climb stairs? No. Okay. Any wheezing? Any cough?
No.
You ever had pneumonia?
Mm-mm.
What of asthma? I remember you said no
No.
to that. Okay. Any breast lumps?
I don't know.
Tenderness?
No, when I'm gonna have my period.
Oh, okay. That's understandable. Hypertension?
No.
Any heart problems? You feel like your heart is pounding?
No.
Okay. Do you ever feel lightheaded when you change positions? Okay. And do you feel like when you're doing, say, Zumba, do you feel like it's hard for you to breathe?
At first, but now I'm used to it.
Oh,
It's
okay. All right. And have there been any changes in your appetite?
No.
You go to the bathroom, all right?
Yes.
How often do you move your bowels?
Twice a day.
Twice a day. And any urine, any blood in your stools?
No.
Any pain when you go? Any abdominal pain or tenderness? Okay, any cramping?
No.
Okay. And do you have any diarrhea?
No.
Okay. What of hemorrhoids? No. And how often do you get up at night to pee?
Before I go to bed, I pee and that's it.
And that's it. Any pain
No.
when you pee?
No.
Any burning? Any excessive discharge?
No.
Okay. And any incontinence? Any urinary tract infection you know of? All right.
No.
That is great. So we are going to proceed with the physical examination portion.
Okay.
So let me wash my hands and then we can proceed.
Okay.
Alrighty. So I just want to start by checking your blood pressure. And I will do that. Can I take a look at your arms, please? Okay, so you do not have. Okay, that's great. So you do not have any abnormalities that will prevent us from using any arm. So do you prefer one or the other? All right. So first I want to get your radial pulse. Oh, that's beautiful. +2 on a scale of 4. Beautiful. And then I'll check this brachial. That is a +1. Okay. So. Okay, what I'm going to do right now, I just want to first of all see where your systolic blood pressure could possibly be before I. Okay. So with that, where was our pause? Excellent. The way so I can see. $120 on 78 is, which is normal. So thank you for that. I am going to wear this glove so I can take a look at your hair. Let me get this chair out of the way. Alrighty. Normal size head. I'm just going to pat your head around just to check your scarf. You have a beautiful scarf on this side. Alright. No scaling or dryness. Your scarf is lovely. And white. Actually not. It's not scaly, it's not dry. Mm-hmm. I'm going to palpate your scarf. Tell me if you feel any tenderness or pain as I do this.
I feel good.
Alrighty. There is no evidence of any break in your skull bones, which is good. So what I'm going to do right now is check on your temporal pulse. First, I'll do this side. Yeah, that is the +1 on 4. And that is a +2 on 4. That is great. Look. Can you open and close your mouth for me? Close, open. Excellent. I'm just checking this joint, and there is no crepitus. It means there is no feeling of rubbing. It's smooth. Everything is intact. That is good. Just keep your face straight for me. Alrighty. Everything seems to be in symmetry bilaterally. So, can you close your eyes slightly for me, please? Great, you can open. I'm just checking to make sure that your eyelids are okay. There is no drooping, which of course there is no drooping, and everything looks just fine. So what I'm going to do is, can you keep your head steady and just follow this pen light with your eyes, please? Great. So that tells me I'm just testing the muscles that hold your eyeballs in place. So with all those movements, it tells me that those muscles are working just fine. So, let me look at white. Your sclera is white. There don't seem to be any discoloration or pigmentation. And your corneal is clear and reflects beautifully. Okay. So, can you do me a favor and just cup one hand and close one eye? And I'm going to show you something to read for me. All right. Can you read these?
Very clear.
Great. Okay. Can you cup the other eye? I'm going to give you a second so you can rest the other eye, the eye you were covering. Alrighty, go ahead and cup that eye. Can you read these letters backwards?
7DIC.
Great. Thank you very much. So, do you use any glasses in reading?
Yes, I have one.
Okay. And do you use them for any other thing or just for reading?
Just for reading.
Okay. And contact lenses?
No.
No. All right. So, can you pick a spot on that window and just stare at it for a few seconds for me? I'll tell you when to look back at some other thing.
It's burning.
It's burning.
Mm-hmm.
Okay. Can you look at the pen for me? All right. I'm going to flash this at the tip of your nose. All right. Great. So when you stare, do your eyes usually burn when you stare at stuff, at objects for long? And do you see an ophthalmologist?
Yes.
Okay.
Because of my family history of glaucoma.
All right. And regularly?
Yes.
All right. Thank you very much. So I am going to take a look at your ears right now. First, I'll look at the skin, which looks normal as the rest of your face. And on this side, normal as the rest of your face. Tell me if you feel any tenderness as I palpate on your ears.
No.
No? All right. And on this side, any tenderness? Okay, I'm going to take a look inside your ear now. Ticklish? Okay. That is great. A little bit of wax, but otherwise it's
A little bit of wax.
yes.
I need to clean it.
Just a little bit. And let's look on this side. Yeah. A little bit of wax, otherwise intact, no discharge, no okay, no break, and it's nice and pink. Alrighty. So for your nose, let me give me. Alrighty. Well, okay. Your nostrils are patent, and there is no deviation in your septum, and there is no perforation, no discharge or bleeding, and the line is intact. Do you smell all right?
Yes.
Okay, so I am going to palpate your sinuses. Let me know if there is any tenderness. Any tenderness? Any tenderness? Any tenderness here? No. Okay, so I'm going to tap a little bit. Let me know if you feel any tenderness. Any tenderness? What about here? Any tenderness? Any tenderness? No. Okay, excellent. Now your mouth. Can you stick out your tongue and say ah? Nice pink tongue. Uvula is centrally located, but have you ever had any problems with your tonsils? Okay. Your soft and hard palates are good, intact, moist and pink. Okay, can you put your tongue? Beautiful. And let me see how many teeth we have in there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, up, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. Ooh, you have all of them in there. You do have all of them in there.
Most of them are half.
I can see that. But do you see a dentist right here?
Yes.
Alrighty. But you have all of them in there, although a couple of them are half, but they look well taken care of. So there's no decay at least. And alrighty. So I am going to go, actually let me sit up and look at your neck. I just want to see that everything is in symmetry, which is great. And your trachea seems to be centrally located, which is supposed to be so. But in a few minutes, I'm going to go to in a few seconds actually, I'll go to the back to check your thyroid. But before I do that, I just want to check your lymph nodes around. Just palpating pre-auricular, post-auricular, submandibular, submandibular. Okay. Can you take up your hands like this for me so I can? Okay. is supraclavicular. Excellent. I don't feel any lymph nodes, which means they're probably not swollen or inflamed, which is good. So I'm going to palpate your trachea from the back. It's going to feel a little bit uncomfortable, but let me know if you feel okay. That is your trachea, centrally located, which is normal. Okay. Can you swallow for me, please? Again. Okay. Your thyroid is felt, and there are no nodules or lumps, which is actually good. So, I need you to do me a favor. Can you move over to the other side of the bed so I can check your lungs from the back? Thank you. I'm going to untie this. Make sure. I'll tie this instead. That nice. All right. Can you sit up straight for me? I'm just looking at your back to make sure your posture is okay, which is your spine is straight. There is no sign of scoliosis, and the skin is smooth, intact. There is no dryness, which is good, and the color is all even, which is good. So I'm gonna palpate on your back. Let me know if you feel any tenderness as I go along. Any tenderness? No. 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 Okay. Good. So I'm going to place my fingers on your back and use my other fingers to strike just to listen to your heart sound, to your lung sounds. So let me know if it's uncomfortable at any point. All right. And we do here for the right middle lobe. Beautiful resonance. And I'm going to use the stethoscope to listen to your lung sound. So I'm going to ask you to take some deep breaths in and out each time I place the stethoscope on a different point on your back. In, out. 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 Great. In, out. In, out. In, and out. Great. Okay, your lungs are clear on all surfaces, which is great. You're going to feel me stomp on your back. Let me know if you feel any tenderness. Any tenderness? Alrighty. So, okay, you can come back to this side. Go ahead. Alrighty. So before we lie down, I just want to take a look, okay, at the neck, and I'm going to bring this a little bit down just so I can see, which is great. Fabulous. Okay, can you lie down for me on your back? All right. So, let me fix this. Okay, go ahead. Lie down. Can you turn your neck to the side and then, all right. So just keep it. I'm going to palpate, I want to feel on your carotid arteries, which is right here. Wow, that's beautiful. That's a solid +2. So then on this side, that is beautiful. That's a +2 as well on a scale of 1 to 4. So can you turn your neck to that side so I can observe your neck veins for pulsation? Oh, that's beautiful. I can see that pulsation right there. Alrighty. And then I'm gonna go to the other side. Yep, I can see it right there. And while I'm on this side, I would also like to take a listen at your carotid arteries. Okay, and the other side, please. So no bruise I heard, which is good. All right, you can put your head up like that. I'm just going to look at your chest. All right, the skin is great. All right, I'm going to do the same thing. I'm going to palpate. If you feel any pain or tenderness, just let me know. Any tenderness? Any tenderness? All right. So I'll do the same thing I did from your back. I'm going to put my finger and I strike to listen to your lungs from the front, and let me know if it gets uncomfortable. That's a beautiful resonance. Beautiful. 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 All right, and then I'm going to listen to your lungs from the front. If you would, please take some breaths. Out. In. And out. In. And out. tongue sounds are all clear. So I'm just going to listen to your heart sounds from the front. But before I do that, I like to feel your apical pores. Actually, let me come on that side so it's easier. Can you slip that hand out? Okay, that is a +1 on 4, and it is regular, which is good. Then I'm going to listen to your heart sounds now. So the aortic, yep, yeah, the love duct, the pulmonic, duct, 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 duct. That is good. First point. That's beautiful. And tricuspid. Excellent. And last but not the least, the mitral. That is beautiful. Thank you. Slip that on right back in here. Alrighty. So I'm going to do the abdominal. So have a beautiful smooth abdomen with even skin tone and color. No break in the skin. The skin is moist, it's not dry or ashy. So using this light, I'm just going to observe pulsations. Okay. Non-observed, you have an inverted umbilicus. So, before I palpate your abdomen, I would like to listen to your bowel sounds so I don't disturb them. Yeah. That's good. And that is good. I'm just going to listen to your aorta right here. No bruise, which is good. So I'm basically going to do the same thing I did. Tell me if you feel uncomfortable at any point. It's beautiful. Okay, so I'm palpating. Let me know if you feel any tenderness. First, I'm going to do this light palpations. Any tenderness? Any tenderness? Any tenderness? I'm going to go a little bit deeper. Just let me know if there's any tenderness. Any tenderness? Any tenderness? Any tenderness? Any tenderness? Okay. Any tenderness? Any tenderness here? Any tenderness here? Any tenderness here? Alrighty. So let me palpate for, see if I can feel your spleen. No, your spleen is not palpable, which is normal. And on this side, I'm going to palpate the liver. Yeah. The lower border of your liver right here, but not the upper border, which is normal. Can you raise your head and cough for me, please? Again. All right, that's good. While you're in this position, I'm going to get your femoral artery. That is a +1 on 4. And that is also a +1 on the 4. So you can sit up. I'll help you sit up.
Thank you.
Thank you. And let me tie this. Alright. So let me just take a look at your arms and hands. Okay. Alrighty. Okay. Okay. Any pain or tenderness? Okay. Any pain or tenderness here? No. Okay. Alrighty. So, can you shrug your shoulders for me? Don't let me push them down. Alright. Can you take your hands up and down and sideways to the back and that and that, that and that. Great. Okay. Relax your arm. Keep it well relaxed. Relax your arm. That's a +1 right there. I was looking for the tricep reflex. And let it go. Relax, relax. That's a +2. That is good. That is good. That is good. All right. So, all right. Just try to look at your legs.
Do I have to take my pencil?
No. All right. Any tenderness here? What about here? Okay. The skin looks intact. A little dryness here.
Yep.
But just some lotion will do.
Okay.
Alrighty. So I'm going to palpate your pulses on your foot just to make sure. So
Would you find them there also?
yes, this is the posterior tibia. A +1, and then we have one right here too. This is the dorsalis pedis, they call it, which basically says is the dorsal portion of your foot. Beautiful. This one is actually a +2. So we do on this foot. Oh, that one was right there, +1, and the dorsalis pedis. It's a +1. I'm actually going to also check on your popliteal. The left foot is a +1. And the right foot is also a +1. Alrighty, can you just relax your feet for me? That's a +1. Sorry, I don't have a patella hammer, so I'm improvising. That's a +1 too. So, do you usually do a self-breast examination? You should do it every month and not before your period when it's all tender and swollen or engorged. So when you're in the shower, you can, or in front of a mirror, all the way to your armpits. If there's any swelling, because we have some lymph nodes right there, and you feel them and you go around, and you make sure you express your nipples. If there is any discharge, you need to report it immediately. And there's any changes in the skin texture or color, anything that is concerning, or any lumps, you need to report it immediately.
Okay.
All right, can you stand up for me, please? All right. Can you come over here and do a walk for me? Toe, heel to toe to the door. Heel to toe to the
Not drunk.
Beautiful. You can walk normally back and then back to the door. Back to the door. Yes. Great. Okay. Can you bend to your toes and back?
Yes.
Great. Back. All right. Keep your legs closed, your hands to the side, and close your eyes. Great. Negative rumor, which tells me that you are doing fine in your balance. So thank you very much. You can sit down. That concludes our physical examination, and so far everything looks great. Thanks for coming, and keep doing the good work in maintaining a healthy life.
Thank you. To be honest with you, this is the first time since I've been going to any care provider, they do this to me. I am so happy.
Yay! Thank you very much.
You're welcome.